Welcome, everybody. My name is Stan Engelbrecht. I'm the current SecSIG president. Welcome to this month's VanSecSIG meeting. The gentleman that is going to be presenting today, I don't even know if I have to give him an introduction. He is simply known as Grandpa Rob, mentor, leader, gentleman with the largest, I would say, historical virus collection likely in the world. Rob, it's an absolute pleasure to have you as per normal in the group. Looking forward to the chat. And I'm just going to go and hand it off to you and let you do the intro from here. So we'll move forward from there. Rob, go right ahead.
Okay, well, thank you. And as usual, you can get all my details there from the QR code, which you can do completely safely. Don't have to worry about a thing, bearing in mind that I got my start in security doing virus research, and so I know all the different ways to get people to install bad stuff on their computers. Security awareness lessons from Dr. Bonnie, and this is interesting. I mean, when Lloyd and I talked it over, and we decided to go with this one. I've still got the NFTs one sort of waiting in the wings for whenever a time slot needs a presentation. But at that point, I don't think either of us really thought that this would be, terribly timely in terms of the news and that sort of thing. But of course, now everybody is screaming and yelling and running in circles over Omicron and that sort of thing. So maybe it's a little bit timely. But of course, the thing is that what Bonnie Henry is doing, week in and week out, is what we need to do fairly frequently. We're trying to communicate often very complex issues and situations and get them across effectively, sometimes to our employees, sometimes to the general public, sometimes to groups of our colleagues. And so, what lessons can we learn from the COVID updates, that what I tend to refer to as the Dr. Bonnie Show, co-starring Adrian Dix and Nigel Howard, and how they all work and what is going to happen there. There is a subtitle to this: Why I Am Losing All the Respect I Had Built Up Over 4 Decades for Vaughn Palmer. Now, for our American guests here, and those of you who are new to Vancouver, Vaughn Palmer is sort of our major political columnist in BC here. He covers the provincial government. He's got a long history there. He knows where all the bodies are buried, and he's really good when he sticks to that. But this year, last year more, he decided to jump in with both feet to the COVID situation, and really made a bit of an idiot of himself by trying to have opinions about an area that he really had not researched and was not completely familiar with. Again, there's a lesson in there for us. The first thing I remember when I published my first book, and I contacted some people because I'd been doing book reviews for a while, and some authors that I respected, and asked for their advice and on getting the book published. And one of the guys actually misunderstood. I'd already basically finished the book. He thought that I was just starting off to write it, and he said, well, first make sure you know what you're talking about. And it's sort of like, Okay, I've been studying this for 6 years now. Yes, I know what I'm talking about. But the media, and I will go after this again and again here as we go through this, has not done us any great service. And in that, the situation is very similar to what we've seen in security, and particularly with respect to viruses and malware. I've seen this over and over again, that journalists were jumping in, having opinions without really knowing anything about the technology, and that sort of thing. And they're one of the examples, as I say, and why I never had any respect for Richard Zussman. Richard Zussman has just, over the past couple of years, proved that he's a complete and total idiot. And I'm afraid that, when he comes on global news these days, I just skip over that particular story, because I know that, there isn't going to be any germane facts and real analysis in this. We're just going to get a bunch of sensationalism. We do not want to make that mistake when we are dealing with teaching people about security issues, trying to make them aware of the dangers, trying to make them aware of what is effective protection. So as I say, the Dr. Bonnie Show, co-starring Adrian Dixon, Nigel Howard. And this is just a masterclass in effective communication of difficult topics and situations. If you haven't been following it, I urge you to. And that URL, and that's part of what I pumped in to the chat there, is that's basically the BC government's channel. And so along with the Dr. Bonnie Show, you're going to get, like, whatever other announcements the government is going to be making on YouTube. But it's not hard to pick and choose the COVID updates out of that. And it's just, it really, as a teacher, as a student of effective communication, as somebody who wants to design effective courses, this is a valuable resource. This is, great examples of what you can do. And what have we got? As a USer, thank you for the BC context background. Okay, you're welcome there. I'm afraid for those of you who are from outside of the country, you may have a bit of a problem there. But we're all familiar with Tor. We're all familiar with VPNs and being able to set your location and that sort of thing. So set your location to Canada. You should be able to get that. And it really, it is worthwhile looking at that. I am, of course, a big fan of Bonnie Henry, and this is her latest book, Be Kind, Be Calm, Be Safe. She actually got two. There was an earlier book, Soap and Water and Common Sense, which basically talks about infectious disease and bacteria, viruses, parasites, anything, whatever can infect people and make them sick. And the different ways, the different types of protection that are appropriate to the different types of infectious agents, and why some work against one thing and not against another. Really, really useful stuff, and again, well written, valuable stuff. And Be Calm, Be Safe is what was written basically at the beginning of the pandemic. And the reason that I stress it here is that there are interesting things that she's expressed in this book. And I put this slide in, later after I sort of built the whole body, and then I read her second book, and it outlines the deliberate decisions that were made and why they were made, why they chose to structure the COVID updates the way that they did, and a number of really interesting and valuable things. And as I say, she's a good writer. It's a good read as well. Interesting. I came across this, and I've stuck it in a few different presentations that I've done recently. Communication process by which a transmitter sends a signal designed to manipulate a receiver's actions in order to improve the transmitters. That's me, inclusiveness. Obviously, this is written by an evolutionary biologist, but it's it's interesting in this context because, of course, this is what we're trying to do. We're trying to communicate. We're trying to get across very complex ideas to our audience, which, whatever that audience may be. And we're trying to do that really to benefit ourselves. We want, the general public, if that's what we're talking to, we want our colleagues, we want our employees to do the right things about security, because getting them to do the right things benefits all of us, not just them, but all of us. The better protected everybody is, the better protected everybody is. It's kind of a version of herd immunity, which of course we have been talking about with regard to the virus and the vaccinations and the pandemic and that sort of thing. But there is a kind of herd immunity that I learned because I came into security via a non-traditional path. When I was starting out researching viruses, I was turned down from speaking at security conferences because people said that viruses were not a security issue. Well, nowadays, anybody would laugh at that, but malware was not considered a security issue in those days. And the thing is that when the people who came to security from a traditional background, they got fed the bastion mentality that we're on the inside, we've got this, fortress around us, or we build a fortress around us, and all the bad people are on the outside. We're the good people who are on the inside. As long as we, keep ourselves separated from those bad people on the outside, we're okay. And as a matter of fact, if, under the bastion mentality idea, if somebody is attacking you, then I don't have a problem. As a matter of fact, if somebody is attacking you, that's good for me because then they're not attacking me. But that, is under the traditional, outsider intruder method. When you look at it from the malware perspective, when you look at particularly in terms of computer viruses, if you get a virus, all of a sudden my situation gets worse. My threat level goes up, my risk goes up. Because you get a virus, the virus is reproducing itself, trying to reproduce itself, and I maybe get, infected by the computer virus that has infected you. So, this breaks down the bastion model, and the bastion model, never really was effective in the first place. It was kind of an illusion, and certainly these days, I mean, we've still got the concept of security perimeter. You have to know what the security perimeter is in order to pass the CISSP exam. But, where is the security perimeter these days? It's just, that sort of thing. And Kevin's saying, does herd immunity work for the internet? It can. I can, think of several things. I can remember alt virus. Was a bit of a cesspool. This is back in Usenet days, if you can, know from the name. Alt virus was a place, a channel where people would share virus code and share tips on how to write a virus and those types of things. And so those of us who were in the antivirus community made a concerted effort to focus on alt virus and to make it a resource for protection. And we would, post messages on there dealing with protection, dealing with how to keep yourself safe, outlining the latest viruses that had been released and how to detect them, all those types of things. And we did actually make a difference and change the whole tenor of alt virus. So yeah, herd immunity can work for the internet. And this is part of what I'm saying here. One of the things, one of the points that I want to make here is to thank Dr. Bonnie for really proving my case, because I'm a teacher. I came from an educational background, and my my educational background predisposes me to regard security awareness with favor. This is something that is important. And all of my career in security, people have been telling me, no, security awareness doesn't work. It's not important. Don't worry about it. Don't waste time on it. Don't waste money on it. Don't waste resources on it. We get down to the real security work. Well, I think security awareness really is part of the real security work. And Dr. Bonnie has proved my case, because she has taken the position that what you want to do is educate rather than mandate. You want to inform people. You want to make people aware. You want to build the base of knowledge. And BC, comparatively, is doing rather well in the pandemic. I mean, right now, yes, we're seeing an awful high numbers. We're seeing lots of people in hospital. We're seeing lots of people in ICU. Notice in all of that, they've been giving the numbers every day on the news. And they've been talking about the, hospitals are overwhelmed and that sort of thing. Well, Robert Preston can tell all of us how, hard people in the health services are working right now. Yes, I do not want to belittle that, but notice one particular metric there that has not changed, and that is deaths. People are still dying, but they're only dying at about the same level as we have had for the past year. And so, BC, in comparison to an awful lot of other places, doing rather well. And our hospitals are pushed. Our medical staff are definitely, working flat out, but we aren't seeing, crashes. We aren't seeing hospitals closing and turning people away as is happening in other places. So BC is doing comparatively well, and pay attention to that. And again, that is because Dr. Bonnie has taken this position of education rather than mandates. Now, there's a ton of stuff here, and actually, I would like people to throw in stuff, and thank you, Kevin, for throwing in a comment, that question. Put the questions out there. Even just jump in. Turn your microphone on and ask something. If you yell loud enough, I'll hear you. But
hey, Rob, Vivek Bonata here. I have a question.
Yes.
I know I've seen a version of this assessment that you made about the educational focus from Dr. Bonnie Henry, and prior to that, I hadn't actually, but I did follow the YouTube channel after you mentioned, and I appreciate the tone, the tenor, and the educational session. But I do have a question though, and this is not from my firsthand knowledge, but from others that I've read on Twitter and in the general social media circles. The provincial government has, steadfastly for months together, not declared what health district, had more cases. In the beginning, it took forever for them to actually agree that that was an important assessment. Similarly, for months, the common statement was, kids were not, at high risk, and other places had to, we need to wait for data from Toronto and other areas and other countries where kids were actually being hospitalized to then agree to a certain extent that kids were also at a high risk. So to my knowledge, again, this is maybe a limited assessment, but to my knowledge, I'm not seeing enough data being shared, because in education, the important thing is to share as much data as possible and then as a good professor, show what that means for the average person. Like what I'm seeing is the judgment being made, the conclusion being shared, saying, hey, this is what we think is good. And that might be the most optimal assessment from a capable doctor or an administrator. But I certainly feel like the background data, the background information is still missing. Do you feel that way, or do you think maybe that's too much noise to share with the public, or what are your thoughts on that?
Yeah, good question. And basically, I would say this is an example of what we need to do in crafting our own security awareness, is make sure that you are providing the relevant information. One of the things, and this slide is coming up, you're kind of getting ahead of the presentation here, but one of the things that the reporters have consistently asked for is predictions in the modeling of the number of deaths, and yes, Bonnie Henry, Adrian Dix have not done that, have not provided that information, which can be done, with modeling. There's no question that can be done. The thing is that that was a deliberate decision, because the assessment that Bonnie Henry made was, yes, they could not exactly predict, but at least model the number of deaths that might be faced. But while that would create sensation and it would create anxiety, it would not really drive or inform any decisions about what to do about the virus, the pandemic, and what protections people needed. So yeah, you do have to pick and choose. You can't just give everything. And as a matter of fact, I do have a slide that says that quite specifically, that just dumping a whole bunch of data, the complete set of data on people, does not help. And we've talked about this before in terms of metrics. And you remember Gary Hinson's presentation and his book on pragmatic security metrics, and making sure that what you are providing in the way of numbers and what you're providing in the way of data is in fact relevant to what's going on. And of course, we've got, as the slide that's been up here, the misinformation and disinformation that's out there. Now, some of it's just plain ignorance. A lot of it is driven by fear. There are honest contentions of honestly held opinions, and that it's hard to say how useful that is to an uninformed audience. Having a disagreement with your colleague is fine. Having a disagreement with your colleague in front of the general public may not be helpful to them, because it just gets them to the point of who do we trust. So there's a question there. In terms of of the current situation, of course, the integrity of information is terribly damaged by people who are deliberately trying to commit fraud or mount attacks in terms of disinformation. So, all of these things have to be factored in when we are deciding how we are going to structure what, the way that we present security awareness. Again, some of you have heard me talk about Win Schwartau. Win's books are definitely useful, but he and I have this really interesting relationship. Not that there's anything personally wrong. We hold each other in high regard. We have, as he said, when we once were able to be at the same conference, he said, something's wrong. I said, what do you mean? He said, we're just having way too much fun. But we disagree on the way to present. And Win definitely goes with the sensational. He wants to be in your face. He wants to grab attention. He's the one who says, you've got to treat someone with dignity and respect, and then takes a 2x4 and hits them over the head and says, but first you got to get their attention. Again, I'm an educator. I really believe in full disclosure. I believe in, giving people the information, and, they will come to the right decision. And that is not always the case. So it's hard to ensure you're on the right side of that debate. But anyways, security theater, we talked a little bit about that. The powers that be, and the things that they do, and we've seen an awful lot of this during the pandemic, and a lot of the presentations that have been going on from different authorities, and just trying to show that they are doing something, even when whatever they are doing is not particularly useful, like these stupid fogging machines that they had early on in the COVID situation. But the media has also been conducting a security theater of its own. And there's, oh, good, the authorities aren't perfect in the middle of all of this. Let's point that out and harp on it. And again, this is not helpful. Just saying, this is bad, running in circles and screaming and shouting does not help anybody. And so again, you've got to avoid getting to that point when you're dealing with the sensational. So when we're building a security awareness program, what do we need? Do we need charisma? Well, if you watch the Dr. Bonnie show, no, not particularly. There's no charisma there. Neither of these people particularly have a lot of charisma. Do they have any bells and whistles? No. It's just the two of them standing up there. And by the way, that was a deliberate decision as well, to limit it to the two of them, so that, well, for one thing, it's not just one person, you've got two people giving the same message. But for the other, you don't have this constantly changing parade of specialists and famous people, celebrities, and that sort of thing. That's not a part of what goes on here. Just keep it consistent, keep the format consistent, so that people pay attention to the information. Anyways, humor, and not intentionally, although there are some interesting and funny examples that go on there. Anyways, as I say, the sensational is not necessarily useful, not necessarily helpful. So, don't panic, and don't build panic when you are designing your security awareness program. Now, when we're dealing with security awareness, for the general public specifically, think advertising, think repetition. I can remember, as got to talk about Gloria. We were driving somewhere and listening to the traffic radio station here in Vancouver, and Maple Ridge Motors come on, and their ad is just a couple of guys yelling Maple Ridge Motors over and over again. We got cars, Maple Ridge, And Gloria said to me, "That's a really bad ad." And I said, "No, it's a really good ad. It's advertising. They want you to know the name, so that when you think about buying a car, you're going to think, of their company name, and just repeating it. Repetition is what we need to do. And so, in terms of security awareness, have simple points. One simple point, and keep on repeating it, or a few simple points, and we'll get to that in a bit here. But repetition. You repeat it in different ways, maybe, but repeat it, and repetition drives the point home. consistency, even if the information is changing, and certainly the information has been changing over the past 2 years. You know, I mean, for one thing, this is a class of virus that we didn't even know existed until 1960s. So it's about 60 years ago. And by the way, this is a Canadian content time. The reason it's called coronavirus is when they discovered it, they discovered this, the shape, the round shape, and the sort of halo around the virus. I thought coronavirus, they were always talking about the spikes and protein spikes on it, and a lot of people were talking about crowns. Well, that's corona, and so I thought, it's a whole bunch of crowns, around it. No, it's the fact that all those protein spikes gave this halo effect to the resolution that you could get it in those days on electron microscopes. And of course, the electron microscope is a Canadian invention. So that's the reason for the name for coronavirus. That's just a little Canadian trivia there. But the having, as I say, the decision to have the Dr. Bonnie Show have a consistent format, even if the information is changing, every day, a new study comes out every day, something changes in what we're seeing, the information. You've got to give people some level of comfort if they're going to pay attention to you. And so again, make sure that your security awareness program has a consistent format, a consistent structure. Even if you have to present changing information in the midst of attack. We talked about WannaCry and Heartbleed was anyways, all the different attacks that we've had recently in our field. The information comes out at us, and it's quick, it changes quickly. We need to follow this information, but we need to be consistent, be familiar when we are presenting it to people, and so pay attention to your format.
Hey, Rob.
Yeah.
Jerry brought up a good question here. Is do we need to take a different approaches to awareness based on generational differences?
Yeah, this is a good point. And again, I've got some slides later on here that talk about this. You can't say the same thing in the same way all the time. As I said, keep the point simple and repeat it, but don't just repeat it. Repeat it in different ways. Have your and different ways will appeal to different audiences. So yes, you are taking I wouldn't necessarily say a specific structure or cognizance based on generational differences, but don't make it all from your own perspective. Look at it in different ways, get different people involved, get feedback from people as to what worked and what didn't. And yes, you will find that there's a bit of a generational situation that some people, the newer generations are going to want shorter, soundbite type presentations, whereas us old folks, we tend to want something with a little bit of depth and analysis to it. But yes, the same message in different formats. Yes, exactly. And we'll get to that again. At the same time, you get the same reporter asking the same question for the 142nd time in a row, or the next reporter asks the same question that you just answered for his or its 7 previous colleagues. You've got to have patience, and certainly Dr. Bonnie has modeled that. If you have watched the COVID updates, that she never gets flustered. She never, so many of the questions out here are, of the nature of, What are you going to do about people who break this rule or don't, flaunt that mandate or whatever it is, my, reaction after the 17th time that I was asked that question would tend to be machine guns, but, that's not necessarily helpful. So it's, you've got to be patient with people. You're presenting this and you're presenting this for, the 3,000th time in your career, but somebody in the audience is hearing this for the first time. And you've got to keep that in mind. You've got to keep that perspective. You've got to, take a breath, be patient with these people. Yes, this is how I say, the reporters are, not doing us a great service, and unfortunately, there are some, and we saw this again in the technical world, in the security world, that we had so many reporters and journalists who, would grab onto a security story and run with it, knowing nothing of what they were, discussing, and making really erroneous statements. But the there were some standouts, John Markham, Krebs nowadays, there are people who, are working with us, who are studying, who, learn the thing, but an awful lot of them are just, this is, today I'm an expert in this happens to be my assignment. And so I'm going to pretend that I'm an expert in it. So, and this is one of the unintentionally humorous ones. Some journalist asked a question is kind of misrepresenting the situation. Of course, an awful lot of these reporters are simply trying to, propound something and get an opinion out there under the guise of asking a question. And this guy asked this huge, long, involved thing that really was kind of an essay, just tacked a question on the end of it. And here again, this is some of the stuff that I pushed into the chat. So he's got this huge long question, and finally finishes, and Dr. Bonnie says no. And that's all she said. Well, that's all she said for about 10 seconds. And then she went on and gave a more detailed answer. But, it's just, so I thought it was a very fitting thing for that. As I said, social engineering, we tend to think of social engineering in terms of bad things and attacking people and that sort of thing. But social engineering is a field that is very useful. Certainly it's part of education. Building, a cute slogan, bend the curve, not the rules. As far as I know, that came from Adrian Dixon, and I thought it was absolutely perfect. So, a simple slogan that carries actually a fairly complex message there. If you can do that, that's good. That's a help. Again, we know this is our field, risk management. And we know you don't get to choose. It's not one of, it's all of. Staying home, distancing, hand washing, masks, snow parties, vaccines, all of that stuff is all of it's protection. We know about this in terms of defense in depth and layered defense. You don't get one free click on a drive-by download if you choose a good password. It doesn't work that way. You have to protect against everything all the time, and you have to take all the protections that you can to reduce your risk. And even then, you may get caught, but stick to the basic principles. And this is important. Stick to the principles, and this has been done over and over again in the code updates in BC. Use illustrations, yes, but stick to the basic principles. What are the foundational things? Because the information is changing. The information is coming along, and whether or not it's, 3 weeks between the first 2 shots or 8 weeks or 16 weeks, whatever. But, the fact that, yeah, you get a shot and you have to wait a while, and the longer you wait, the better result you're going to get in the end, is an important principle. And, that doesn't change regardless of, whether everybody argues about whether it's 7 weeks or 12 weeks or whatever it may be. The principle is the important thing. Stick to those principles. Again, with the 2-dose vaccines, it was fairly simple math to prove that there was a greater good to delay the second dose. And, doing that principle recommendation and explanation, I did a lot of good. Now, this is an interesting one when we start, looking at cost benefit analysis. And of course, we're talking about isolation versus reopening the economy. Now, we, in terms of our principles, security is supposed to serve the business, but life safety is always the #1 priority. And so there are balances. You cannot simply stick to one principle and say that is the overriding principle for absolutely everything that goes on. And so, we are in these complex situations. We are in the real world. We have to base our security awareness training of whatever type on the reality and the complexities of that reality. And we need to make sure that is apparent to everyone. Another thing that we have seen is that emergency management, of course, the pandemic itself is emergency management in one respect, but of course we've seen it over and over again over the past year with regard to the fires, the floods, the snowpocalypse, whatever is going on. Emergency management is for emergencies, and it's not going to be perfect. It's never going to be perfect. You plan in advance as best you know how, but there's always going to be something you miss, or there's always going to be a twist that you did not anticipate. There's always going to be an Omicron that comes along just as you thought you were getting the vaccine situation under control. Do not expect perfection. Now, how does that address? This is in a sense aimed more at the general public than those of us driving security awareness and training. But don't set yourself up for a fall in this regard. Make sure that you aren't presenting yourself as absolutely perfect. You have to present, we're doing the best we can. We're trying to save as many lives as possible. We're trying to keep the hospital system from collapsing, whatever it may be. But do not set yourself up for a situation where somebody comes along and says, you promised that once we got to 70% coverage on the vaccine, that we could go back to life as we did it before. Don't promise anything that specific. By the way, in terms of emergency management, I can recommend this unreservedly. Search and Rescue North Shore. It's on the Knowledge Network. Was on the Knowledge Network. It tends to get replayed, I imagine, but you can go to their website and stream it yourself. It's an absolutely gorgeous 5-part documentary series. It was shot on the North Shore. Of course, it's absolutely beautiful, and of course, all the people in North Shore Search and Rescue, some of which I trained with. So it's that I would highly recommend. And for those of you who are not from Canada, again, use the VPN and set it to Canada and go and look it up. It's really good. As I say, an awful lot of the questions that got thrown at Dr. Bonney over the last couple of years, how vicious are you going to get with people breaking distancing rules or breaking numbers rules or breaking, whatever, and gyms and, whichever it may be, how are you going to punish these people? How are you going to jump on them? Because everybody's angry and they want to vent their anger on somebody. Right now, I am angry. My wife has died. I've lost my friend. I've lost my home. I've lost my job because I was basically her caregiver for the last 7 years. I've lost an awful lot. And so I'm angry at the world. And this was not the time for Lucky Mobile to decide to mess me up with support. And I actually am probably going to be finishing up over the next couple of days, writing up that thing with Lucky and Bell and Counterpath and that sort of thing. So, don't annoy people unnecessarily. But the thing is here in terms of looking at the situation and in terms of the way that Dr. Bonnie has answered those questions about, how much punishment are you going to load on people who, do things that we don't like. And, her presentation has consistently been, you catch more flies with honey than vinegar. Don't dump on people, don't punish people. Use the carrot as often as you can, not the stick. And, that's really been useful and helpful and successful, really. Because as I say, security awareness has been our unregarded field, and Dr. Bonnie has stressed education rather than mandates, and BC is doing comparatively well. Now, as per the question earlier, like I said, transparency, accountability, everybody wants everything. Metrics, lots and lots of metrics. We want all kinds of numbers, even if we don't understand what they are. So here's your promised answer for that. The company notified you of a breach and shared the incident details and insights on the adversary, but they didn't share the data. But you have what you need. If we had forensic imaging, maybe we'd find more. Maybe, likely not, but all data isn't realistic and sharing it poses other risks. Well, they aren't sharing that. So anyways, do we need a break?
I think maybe we'll take a quick, maybe 15 minutes so people can get up, stretch, go to the bathroom, grab a drink, and go from there.
Is there a reason why you put that comment in red before the break?
He's down a whole other path. With that, Rob, maybe I'll let you take it back over again.
Yep. Okay. So then back to where we were. Interesting thing, the difference between the Dr. Bonnie show and some of the other things that we were seeing in the States particularly, or well, Ontario even, and Alberta next door, use an authority, not an authority figure. You will notice that it's Dr. Bonnie, it's not Premier Horgan. You are talking to the person who knows, not the person who is interpreting the person who knows. And we saw in Alberta it was Kenny, in Ontario it was Ford leading the day. You had the medical health officer behind him, literally, and New York, they had Como and so on and so forth. But get the person who really does know. And in our own field, I am really sick to death of technical presentations supposedly from the VP of marketing for various companies and that sort of thing. I want to know what your thing actually does, not what you think you can sell it to me on. And I would imagine that an awful lot of people feel the same way. So again, metrics, and this was this is really interesting, looking at the metrics that we have had out of various presentations, and case counts, case rates, doubling rates, death rates, case per capita, hospitalization, ICU rates, all of these numbers, the positivity on testing. And as I pointed out before, the BC's film industry actually skewed the positivity rate for the province, because even though they were doing their testing separately, so they're not taking away from testing capacity, but it's still reportable, so that the positivity rates got modified because of the number of tests that the film industry was doing. So you've got to be careful with the metrics. And again, this comes back to the issue of, do you give people all the data? Well, do they understand all the data? Do they understand the implications of the data? Gloria's hospitalization. The hospital did not want to tell me that she was likely going to die. And it was Martin Welu, who himself is a doctor, but he hangs out on the CISSP forum. And it was him giving me the first indications of this. And it was days before the hospital would tell me, because the hospital does not want to present themselves as the bad guys by saying, well, your loved one is going to die, is probably going to die, is in mortal danger, and that's until they have exhausted all the other possibilities, check this, had a report on that. It's the same way here. That some information is just not useful to our audience, and you have to be careful about that. Again, as I say, this comes from Be Kind, Be Calm, Be Safe. That they did the modeling and they presented the modeling, but not projected deaths, because that was not useful. That was not helpful. That was not going to direct any of the protections and any of the mandates that they were going to make. But the metrics themselves, the numbers themselves, do support what Bonnie Henry has done. Now, again, I did this almost a year ago, in March or April of last year. So comparing the data in March, as of March 2021, comparing to the data per capita to the rest of Canada, BC should have had 3,000 dead. Comparing us to the US, BC should have had 6,000 dead. And at that time, BC had just over 1,000 dead. And so, using the metrics, using the data, you can say that Dr. Bonnie saved 5,000 lives from November 2020 to March of 2021, and continues to save lives, because you just have to look at the relative numbers there. Look at those metrics, and it proves Dr. Bonnie was right. Her educate, not mandate mantra worked. And so what this says to me anyways is that security awareness works, education works, training works. This is, in contention with, as I say, lots of positions, or the position of a lot of people in our industry, that security awareness training is not important. And here the numbers say different. Again, looking at the numbers, BC plateaued at about 500 cases per day since November of 2020, and that has continued roughly up until November of 2021. There were ups and downs, but it really was a very consistent level throughout that entire year. And Dr. Bonnie said, vaccinate the old. A lot of people, argued about that and tried to second guess her on that. Well, the deaths per day in November were 20. The deaths per day in March were 5, and the deaths per day continued to be about 5, again, throughout that entire year. So Dr. Bonnie is saving 15 lives per day. And that's basically, still the same. So again, her educate, not mandate mantra is in fact effective, and provably so, demonstrably so, using the numbers. Education saves lives. So going back to Kevin and Jerry's questions and comments, yeah, change things up. Last year's commercials are boring. Somebody comes along with a new clever commercial, and it's clever for a few months, and then everybody gets used to it, and it becomes boring, and it becomes a joke, and that sort of thing. Come up with a new slogan, come up with a new illustration, come up with a new analogy. Don't change the principles. Stick to the essentials of what you're doing, but change the way that you are presenting. And yes, do that all the time. You're constantly having to change what you're doing. You're constantly having to present in a different way. Make sure that you are addressing and check that you're being effective. Follow up with people. Find out what they think they have learned from the session, as opposed to what you think they were supposed to have learned from the session. In terms of security architecture, we so seldom really think about architecture. Was it Stan talking about somebody wants a security architect? But anyway, functional versus assurance requirements. And this, really goes back to the common criteria, or was promulgated anyways, most clearly with the common criteria. Part 2 is the functional requirements, part 3 is the assurance requirements. So the functional requirements are what we tend to think about. They are, the things that we do. They, having a firewall in place, having good passwords, having, all of these types of things. That's the functional, and we tend to forget that we need other aspects, and those are the assurance requirements. Are the functional requirements actually working? Are they functioning? Are they doing what we think they are supposed to do? Are they being effective? And so this is illustrated in broad terms by restaurants. And now restaurants, for the most part, have hand washing requirements for the staff. The staff is supposed to wash their hands, after they go to the bathroom. And you'll see the signs up there, and they, staff are to wash their hands after using the washroom. But you can't tell if somebody has washed their hands. They come out of the bathroom, their hands are dry. Did they wash their hands and then dry them, or didn't they wash their hands at all? So, you don't have assurance requirements there. But if you go to the Subway, it's a fast food place, obviously not exactly a restaurant, but here they are putting on these, cheap plastic gloves, but they're gloves. And you can see that their hands are not touching the food that they are making for you. So, the hand washing is effective and the gloves are effective, but the hand washing doesn't give you the assurance requirement, whereas the gloves do. You can see it. Now, extend this into things like the mask mandate in schools. The functional requirements there are isolation, masks, physical distancing. They're all problems in schools with kids. Kids glom together. So how do you isolate them? They don't like masks, as we heard earlier. Physical distancing. No. Physical distancing to a kid is like 3 millimeters. Although it's hand washing is something you can get kids to do. You make a game out of it, and they will do it. But anyways, the assurance requirement isn't directly applicable there. This is detailed contact tracing. And so in the early days, everybody was saying, oh, the kids are at risk, and what we need, more masks, we need isolation, we need, this, that, and the other thing, all kinds of things they thought they need. And what we found, what the detailed contact tracing proved with metrics, with data, was there was very low transmission in schools. And so we had all of these, functional requirements that people wanted to layer on top of a situation that really was not all that dangerous, at least not at that point. On the other hand, some of the mandates closed bars, but not restaurants. And so that bars could serve alcohol until 10 p.m., but they couldn't serve any alcohol after 10 p.m. And what's the difference in terms of, is alcohol any more dangerous after 10 p.m. than it is before 10 p.m.? Alcohol is dangerous all the time. So, what do we do? Well, just look, the mandates go into place, and oh, look, we've reduced the numbers. So again, the contact tracing, the results, this seems like, to some people, a silly functional mandate, but actually it works. It's effective. It does something. So again, have the assurance requirements, have the assurance metrics there, as well as the functional requirements, and know what you're going to do. In terms of the security awareness and training, don't speak down to people. Even when you're dealing with complex topics, people will get it if it's explained properly. And, so a guy by the name of Albert Einstein said, if you can't explain it simply, you don't understand it well enough. And he was pretty good at that. By the way, this is quoted in Soap and Water and Common Sense. Understand these things. We don't have to oversimplify our security situations or our security threats or our security protections. Explain it properly, understand it. Well, one of the people is a really bad example of this is Sean Harris with the all-in-one CISSP guide. And as some of you know, I refuse to answer any question that starts out Sean Harris said. Sean Harris did a wonderful job and a wonderful service to security and CISSPs by producing a book that was readable, that people understood, that did give people confidence to go and write the exam and pass the exam. The thing is that one of the problems that Sean Harris had was she was perfectly willing to explain things that she did not in fact understand. And so, she would try and explain complex topics without going and researching and finding out what they actually were in the first place. And that was bad. That was, but, if you do it, if you understand it, you can, when you understand it completely, you can explain it simply, basically, essentially, to pretty much anybody. So do that. Make sure that you know your stuff. Again, defense in depth is it's a topic that obviously has not gotten across. One thing that the pandemic has definitely illustrated is we as a species, human beings, do not understand complex risks. And risk management, we're really bad at risk management in the modern world. We're really good at running away from saber-toothed tigers in the long grass. But when it gets more complicated than that, we're not real good at it. And so we need to present some of these topics, some of these principles that you need all of these protections. You're not just saying, staying home is not a perfect panacea. It's not going to get you through. Staying distanced from people is not perfect. Hand washing is not perfect. Masks aren't perfect. Vaccines aren't perfect. I'm sorry, but that's the reality. That's real life. And we need to present this reality when we're dealing with security in the same way that it's had to be presented and ultimately has not been presented terribly well in the pandemic. People are not understanding that this is not a pick and choose situation. Just because you put a mask on does not mean that you can go to a party with 150 people who are all unvaccinated. Now, it was really illustrative over the last year to look at the difference. The BC Wildfire Service obviously had looked at the COVID updates and tried to do the same thing as the Dr. Bonnie show. So they had metrics, but unfortunately, they did not have the right kind of metrics. The pandemic and the wildfire season were completely different situations. And you can't just, throw some numbers out there, throw some data out there. You've got to give it context. It's got to be relevant. It's got to be, accurate. It's got to be meaningful to people. How is this number going to tell people what the implications are for this particular fire? And that did not happen with the wildfire service. They just, they did not manage to do the same thing that Dr. Bonnie did. They didn't have a consistent format. They didn't have a consistent face. They didn't have consistent messaging. They didn't have communications with the rest of the government in the same way that was presented, that was demonstrated with the Dr. Bonnie show. And so that is illustrative. Go back and look at what the wildfire service did and compare that with the COVID updates. And that will, the fact that you have a good example and a bad example clarifies a number of the points about how you do this, how we should be structuring security awareness in that particular way. So, okay. I'm a big fan of Dr. Bonnie. I think, right now she's getting real hammering from a lot of people because Omicron has come along and just, changed the situation. And we're in a more difficult situation than we were in before. And that's too bad. But it's not her fault. She's doing her best and she's still doing her best. And just going through her mantra, be kind. And this is something that we need to know, that we need to take to heart in security. We are very often the knights who say no. We're the bad guys. We're the people who are preventing, our employees from doing what they legitimately need to do in pursuit of their jobs. And we need to turn that around. As I say, security needs to support business. We are there to help. And when you take that, when you really take that attitude, it changes your relationship with the rest of the company. It changes your attitude to your work. And I really encourage you to look at that. Every time you are making a decision, when you are creating a report, when you are advising senior management or whoever, and particularly when you are doing security awareness training, be kind. Direct what you are doing to the protection of the people you are talking to. Be calm. As I say, that has been a guiding characteristic of the Dr. Bonnie show. Her patience. I mean, this is the patience of Job. Everybody talks about the patience of Job. If you actually read Job, Job was not a particularly patient person. When his friends come and attack him, he gets really sarcastic. You know, some guy goes into this long-winded, you know, explanation and says, really, you've done bad things and you should admit it. And you know, and you know, Job comes back with, oh, doubtless you are the people and wisdom will die with you, but I have a brain as well. And you know, goes on to answer everything that's been said. But you know, Dr. Bonnie has you know, been the proverbial patience of Job, not the actual patience of Job. She has been patient, been calm. And again, that the First Nations name that was given to her, you know, one who is calm among us. So, you know, if Rudyard Kipling's poem, you know, if you can keep your head when all about you, everybody is losing theirs and blaming it on you, you know, that's what's happening with us in security. And that's, you know, we need to be calm in the midst of all the crises that come around us. And be safe, be careful in all of this. Be aware of the dangers to yourself. Be aware of the risks that you run in sensationalizing the situation, in trying to either, you know, raise awareness or raise your own profile among people. You know, don't get caught up in your own hype. Be you know, be calm and extend that calmness and be safe. Protect yourself, protect your position, protect your job and function within the company. Keep yourself safe. And again, this is emergency management. Emergency management, you know, in the same sense, hypocrisies, you know, first do no harm. And emergency management is first do no harm to yourself. You know, don't go into a dangerous situation just flying in like the hero without planning, without preparation, without knowing how you're going to get out again. You know, be safe, maintain safe, make sure that your, you know, systems are protected, because your systems are the ones that are then helping to protect the rest of the enterprise. So a number of issues there. So, questions, comments, discussion. Okay, either I've done a completely thorough job and this is all wonderful, or nobody has understood a thing I've said.
No, you didn't, because I got a question.
Yeah.
So looking into your crystal ball, a year from now, where do you think we're going to be as far as this assessment? So if you're given this same presentation a year now, what do you think you'd be saying? Or what do you hope to be saying?
Well, the same thing, because I'm talking about security awareness, but are you meaning in terms of the pandemic?
Well, the pandemic and anything else that may spill over that we may learn beyond this. I mean, do you know if they're going to do a lessons learned or anything like that?
Oh, I think, you know, we're going to be learning lessons from the pandemic for decades.
Okay.
I mean, you know, we're going to be learning medical lessons, certainly, but yeah, I mean, one of the lessons that I have learned, well, I've said, you know, one of the lessons is security awareness is important, but one of the other lessons, for 40 years, I have been thinking that the major business thrust on efficiency is a problem, and I did not know why. And the pandemic has brought it home. When we are efficient, when we cut margins, when we cut costs, when we cut everything, you know, get lean and mean and you know, pare things right down to the bone, then if something comes along, you are not resilient. Efficient companies are not efficient. They are brittle. They are not resilient. They cannot survive, anything really, and certainly, the pandemic has been a major blow. But you just, look at the number of companies, large and small, that have not survived from this. And big companies that did business continuity and all that kind of stuff, but because they didn't have any fat left when push comes to shove, and when a crisis comes, they don't have any margin, they don't have any resilience. So that's just one of many lessons. And like I said, in terms, I've got the other 3 presentations on security lessons of various types from the pandemic itself, from COVID-19. Yeah, there's an awful lot, mind you. Unfortunately, there's lessons to be learned, but you have to survive in order to learn them. And I think an awful lot of people just simply aren't going to learn these lessons because they aren't going to survive the situation. There's a lot of businesses going down.
Rob, when we were just before everything started, we were talking just about different security events, shall we say, that happened, and how, I mean, it's like preaching to the choir on this one. It seems like nothing ever no checks get written or funding gets released until something bad happens. An interesting article just in terms of, I think it was from Al Jazeera actually, that had an article on one of the problems of the Canadian healthcare system is exactly what you just said. Our hospitals are designed to run lean and mean. We tend to look at hospitals across Canada, whereas they're almost designed to run at near full capacity.
Yep.
The whole time. And the article I read pointed this out, is that is a problem, because when we have an event like this, there aren't the necessary beds in terms of units available when something like this happens, which is a disastrous event. So I'm gonna piggyback on Kevin's question here. What do you think the healthcare industry is going to learn about that? And do you think that's going to have any impact and change on how they look at designing, funding the healthcare infrastructure? Because we see it all the time in the security infrastructure, that it's not until something disastrous happens do the floodgates of funding open up.
Yeah, well, I unfortunately, I don't think the health system is going to learn a lot from this. I mean, there are going to be people, but I mean, I was working in the hospital more than 40 years ago, and I was seeing the same thing then, that they were cutting back the number of, for example, registered nurses and trying to replace registered nurses with practical nurses. So they're trying to trim the money, they're trying to cut the budgets there by skimping on the resources there in terms of getting, replacing higher paid, more qualified people with lower paid, less qualified people. And I don't want to negate the contributions the practical nurses make. They do make, but they don't have the same level of training and background. And that was, like I say, that was more than 40 years ago. And I've only seen it increase in the years since. And so, yes, you're right. They have done that. They have trimmed and tried to run at capacity and tried to run with as little staff as possible. And when you're running at maximum capacity, you don't have surge capacity when there's a surge. And what are you going to do about, you cannot manufacture nurses instantly. It takes 4 years to train them. We need to ramp that up. I unfortunately don't think that lesson is going to be learned, because it has not been learned in the past 50 years. So for a while we are going to see this. We are going to see some lip service paid to staffing at somewhat higher levels. We are going to see some lip service paid to putting more efforts, more money possibly into training capacity so that we, can have that. But again, we're going to see some of that, and then people are going to get back to saving, shaving money off the budget, and it's going to happen all over again until the next emergency.
Hey, Rob, Vivek Panada here. I have a quick comment. I'm actually slightly more upbeat about the lessons learned, just based on my kind of experience in the finance sector. So to your point, efficiency, the context that you used includes a bunch of things, right? Capacity, flexibility, a lot of things combined into that word efficiency in order to be resilient. An example is companies in countries where interest payments are tax deductible. You never see 100% debt because they're aware that quarter to quarter business conditions change, revenue changes. So if you're not able to pay interest, then you'll go under real quickly. So there is a debt burden limit of about 60% or so, maybe 70% for most companies, because these executives know that if you don't have that little bit of equity flexibility, then you'll go under real quickly. However, there might be some kind of hyper growth companies and hedge funds and such that can go beyond over leverage and all that. But in general, most companies are managed really well with the understanding that you have to be resilient quarter to quarter. I think in the healthcare industry and in general, any industry that is longer term, that's the problem, because the decisions made by these people, the impacts are not felt right away. They're felt decades later. By not investing in nurses, for the next 2 years or 3 years, nothing is going to change. So the people that made the decisions cannot be held accountable for those bad decisions. I think that's the key. So if we can hold people accountable to actions that, no matter how long ago they did, based on the decisions they made, then it will impact, it'll change really quickly. Then, people will make the right decisions knowing that if I cut something off, they can come after me, 4 years later for having made a bad decision. Because right now, none of these managers are directly or indirectly managers or politicians or anyone in leadership, really. You can make bad decisions and you're gone 5 years later. The outcome is not connected with you, and you just ask whoever is that current leader at the time when they were just a recipient of the bad decisions somebody else made. So I think if somehow we can either shrink the timeline or make hold people accountable for decisions they made. I have seen it in other industries like finance, the example that I make, that people will make automatically good decisions because then they have to be accountable. They know that they'll go under otherwise.
Yeah, we can't exactly shrink the timeline. So unfortunately, what we have to do is try to convince people to have somewhat longer memories. It is, it's very interesting to look at that and the issues of what affects somebody who is making the decision right now, and how can we get them to project, to consider the additional and usually very important factors that unfortunately are not considered too often. But yeah, it's definitely and in finance, I mean, when you look at the literature, the security literature on risk management, it owes an awful lot to the literature on risk management out of the financial industry as a whole. And unfortunately, one of the things that we have forgotten in our own literature on business continuity is to look at what is a major part of the financial industry's risk management, and that is capital risk. And capital risk is basically just, do you have enough money to survive some untoward event? And enough money means, it's basically, do you have the resources? Do you have the margin? Can you survive a downturn? And lots of companies that went through the business continuity planning cycle and disaster recovery planning and all of that stuff, in technical terms, missed that capital risk part of the assessment. We've left that out, even though it's fundamental to the financial services, where our literature came from, and we should be paying attention to it. Again, when you actually read the financial services risk management stuff, all that we talk about in terms of risk management comes under a small corner that they tend to call operational risk. And the bulk of what they're doing is this assessment of capital risk, which we have completely neglected. And so, yeah, there's no capacity, there's no resilience, trim the fat, bump up the profits, and get the short-term profits out, so that the stock options vest and those types of things. We need to learn those lessons. And again, I very much doubt that we are going to. Sorry, was I too vicious there, and everybody's scared off? Nobody's going to comment.
I appreciate it. Thank you, Rob.
Rob, I actually have a different question, going back to the data transparency and data understanding issue about the general public. Since most people are not equipped, or most general people are not equipped with understanding data and the complexity of it, or trying to figure out the relationships between one event and another, and especially for the COVID pandemic, since it's such a large scale. Do you think this will be like a good lesson for people that are responsible of handling the pandemic and the general public to understand of the importance of educating the general public how to understand that data if it's transparent, and how to verify it, and how to make sure that what they're looking at, they understand it very well? Or will there be some sort of platforms or some guidelines that we can create in the future if we are presented with something similar like the COVID-19 pandemic?
Well, I definitely think this is important. I think that this should be part of school curricula. I think that this is always areas that are far more important than an awful lot of things that we tend to stress in education, in training, in all kinds of things that we do in the name of education. The CISSP exam itself, I've always said to people, it's not so much about knowing the technical nuts and bolts of our industry as your judgment, your critical thinking of the implications of a given situation. So yeah, equipping people, equipping the general public, equipping school children to understand the basics of risk analysis, risk assessment, which we do every day. I mean, I do not understand the difficulty that we have talking to management, because if you are a manager, you manage two things. You manage people and risk. It doesn't matter what you are a manager of, what type of manager, what level of manager, you manage people and risk. And so, managers, business managers of whatever type, at whatever level, should understand us when we talk about risk assessment, risk analysis, risk management, and yet they don't. And I do not know what the disconnect is, but we need to overcome that. That is a blockade that we need to break. We need to get through. We need to communicate with people on this level, because they are dealing with this all the time. And we as a species are bad at it. And we need to understand it better in the modern complex world. Like I say, you know, we had millions of years to evolve running away from saber-toothed tigers. You know, now that we're dealing with, you know, microbes and computer viruses and disinformation and you know, all these things in our complex interconnected society, we need to look at risk in a different way. We need to look at it more formally. We need to understand what the risks actually are. And yes, I think there are some, I mean, you know, I started this whole thing, you know, all of these security lessons bits from explaining to you, my colleagues, about the pandemic and the virus, from, you know, my limited background in medicine and our common understanding of risk management, of, you know, security and the concepts there. And then from that, I realized that, you know, there were a whole bunch of lessons to be learned there to reinforce what we already believe and should know about security. And you know, then came the conference presentations, and then came the book, and now, you know, this sort of side issue in terms of security awareness. Yes, there are so many lessons that we should be learning. This is a valuable teaching experience that, you know, God has dumped on our heads, and we should be learning from it. There are so many lessons we should be learning, and this, what I've talked about today, is only one.
That's amazing. Yeah, thank you.
You've had a lot of compliments in the chat there, Rob, just so you know.
Okay.
So I'm also going to say
you.
it was a fantastic presentation. Really appreciate it. It was neat to interconnect the two and provide some lessons for our own industry from this one. So from me, very appreciative. Always learn a ton.
Thank you.
Alrighty. Well, Rob, I'm going to say a very big hearty thank you again for taking the time and for presenting for everything. And thank you everyone for attending. Something that we were talking, there's a few of us that were talking actually even before everything started. We're just, you know, Rob was making mention the fact that there's a lot of groups that have had serious issues getting members to hop on, and this group has been incredibly stalwart on that. I think we've averaged like 50 plus people every single meeting throughout the course of the pandemic, which is a testament to the work that's been done for the last for years and years and years, Rob, when you were heading this up, and Orvin, Chet, and the other leadership groups. So it's a pleasure to be in here with everybody. I think with that, we'll wrap it up for the day. Again, if anybody needs connecting to, you can always reach out on the infosec.bc.org website. It'll link to a number of different places. You've got Rob's contacts and the rest of ours. And yeah, we'll see you on the Slack channel. I should also mention, if you have access to Slack, you can also reach out to Orvin and others on there. If there's job postings or you're looking for a job for that matter, there's the announcement section and job sections on there. So it's a great place and a great resource for everybody. So with that, we'll close it off. Thank you so much for everyone being here on the first meeting of the VanSecSIG, and we will talk to everybody next month. And with that, Rob, again, thank you so much. Take care, everybody. Stay safe.